Right. Yeah, the update regarding the rejection of the US 350 million by ED, yeah, health funding. Right. I think, guys, you've already seen a lot of information regarding this. Uh, Emmerson Mnangagwa has reportedly rejected a proposal, US 350 million health funding package from the United States, citing concerns over national sovereignty and external influence. The decision has sparked debate both domestically and internationally, as it comes at a time when Zimbabwe continues to face significant challenges in its public healthcare system, including shortages of medical supplies, underfunded hospitals, and limited access to essential medicines in rural areas. Right. I think iyo nyaya iyoka everyone knows about it. Iri kunetsa. I think Opol Chimono has been saying, a lot about shortages in hospitals and so on. And tiri kuona kuti apa pari kuitwa reject, citing those concerns. Uh, I think it would have been important as well to have a look at the memorandum of understanding and see what are those things that prompts the rejection. Now, according to government officials, the funding package was intended to support a range of health initiatives, including strengthening uh, primary health care services, improving disease surveillance systems, expanding HIV and AIDS and tuberculosis treatment programs, and upgrading medical infrastructure. However, President Mnangagwa's administration argued that certain conditions attached to the funding risked undermining the country's policy independence and could open the door to undue foreign influence over national health priorities. Yeah, apapa zviri paviri handiti. Let me start with the first one. Yekutanga ndeyekuti, you see, United States iri kuona gap, handiti uri kuzviona, iri kuona gap kuti there is a gap rekuti you are not attending to your hospital or to your health needs of the country. Now they want to chip in, wazviona, they want to chip in and help, but the thing is, kana vachita chip in havazviitiri mahara izvozvo. They will always need something in return, handitika, of which we all know what it is. Minerals, chakuti chakuti, we know that. But however, the second aspect imwe yatiri kuona ndeyekuti, now benefit inenge iripo, the problem ndeyekuti iri kuzobenefita the people of Zimbabwe. Ndo pane problem ipapo, because if it's gonna benefit the people of Zimbabwe, obviously government yedu yatinayo iko zvino izvi doesn't like that. Asi dei anga ati tokupa iwewe as a personal, as a ningikiri, tokupa mamillions akati, then toita chakati vachibenefita ivo, then I think it would have been something chekuti vai accept, but they wouldn't accept because of the fact that the people of Zimbabwe are going to benefit from those hospitals. That's one thing why this is being rejected. Now, in a statement explaining the decision, authorities emphasized the principle of self-determination. They argued that while international cooperation is welcome, assistance should not compromise the country's ability to chart its own development path. The government maintained that sovereignty is a cornerstone of its post-independence identity and that external funding arrangements must align strictly with national interests and development strategies. Officials suggested that some of the proposed oversight mechanisms, reporting requirements, and policy conditions tied to the funding were viewed as intrusive. While that is true, and it obviously zvinouya zviine zvinhu zviri attached to them, handiti zvinouya zvakadai so zvichitaura izvozvo hazvi zvemahara ka, hamungapiwi mari mahara, because obviously these people need to benefit as well. Asi the biggest message yandiri kuona apa ndeyekuti fix your health system chete, Why can't you just fix your health systems? Morega kungowana vanhu vanoti regai tikubatsirei in that area, so that they will take minerals acho kana kuti whatever you don't want, or why you refusing to do that. Handiri kuzviona. Saka zvinhu zviri important izvozvo. Zvinhu zviri important izvozvo. So the move reflects a broader political narrative that has characterized Mnangagwa's leadership, which often stresses economic independence and resistance to perceived external pressure. Since taking office in 2017, his administration has sought to re-engage with Western nations while simultaneously prompting the idea that Zimbabwe will not accept arrangement it views as compromising its autonomy. The rejection of such substantial health package underscores the delicate balance the government is attempting to strike between attracting international investment and aid and maintaining control over domestic policy decisions. Yes, it's difficult to balance that because balance through the aid at the same time, through the, we want to fix these things, but the bottom line is the same. Just fix the hospitals and everything. Healthcare system yose ngaingofixwa. I think we are able to do that because my minerals actually why can't we just use them to fix our hospitals? Toregera kuwana munhu anopindira pakati. Because apa zviri kuitika ndezvekuti I can give an analogy yekuti chi iwewe unoonekwa kumba kwako iwewe usingagoni kuprovida vana vako handiti. Umwe munhu oti chirega ndibatsire vana vako inini. Iwe undipe mari yacho. Handiti unayo. Chindipa mari yacho inini ndibatsire vana vako. That's exactly what's happening here. Critics of the decision, including some health professionals and civil society groups, have expressed concern about the practical consequences. Zimbabwe's public health sector has long relied on donor funding to sustain key programs, particularly in the fight against HIV, AIDS, malaria, and maternity mortality. Opponents argue that turning away 350 million US dollars could place additional strain on already limited resources, potentially affecting vulnerable populations who depend on subsidized or donor-supported services. They contend that in a context of economic constraints and high public debt, external support can play a crucial role in stabilizing essential services. Vafariri vanhu havadi zvevanhu zvokuti kwai vanhu vanozosafa izvi, it's out of their ningikiri. Unofunga kuti vane basa nokuti vanhu vachasafa here zvokuti vanhu vanga vachirelya nema-antiretroviral drugs whatever havana basa nazvo izvo. They just don't care about that, because that's why you find kuti hospital inoshayikwa zvinhu zviri required. Unofunga kuti dei vanga vachida kuprovida vanhu nezvinhu izvozvo, they should have done that already. Now, supporters of the government stance, however, argue that aid dependence can create long-term vulnerabilities. They suggest that accepting conditional funding may perpetuate the reliance on external donors rather than encouraging sustainable domestic financing solutions. From this perspective, the rejection could be seen as a push toward strengthening internal revenue mobilization, promoting public-private partnerships, or seeking alternative sources of funding without stringent political and governance conditions. Right, andimurikuona. So, chitiudzai kuti what do you think about this rejection of the US